Alrighty, it looks like everybody's made it to their way in. On behalf of the Florida Department of Health in Volusia County, welcome again to the 2021 Path for Hope Virtual Summit. My name is Jordan Holly. I'll be facilitating this session. You've decided to join the session titled Recovery Schools, Missing Piece of the Continuum. All participants will be muted during the session. There will be time for questions and answers at the end of the session. If you have any, just raise your hand using the reactions button at the bottom of the screen, and then we will call on you and allow you to unmute yourself. You can also submit any questions during the presentation in the chat box, and we'll pose them to the presenters at the end of the session if there's time. If you have requested any CEUs for this session, please indicate your presence by responding to the pop-up poll mid-session. Thank you to the Path for Hope Summit Planning Committee partners, Advent Health, Community Coalition Alliance, One Voice for Volusia, SMA Healthcare, and the Volusia Recovery Alliance. It's my pleasure to introduce your presenter for this session, Dan Renaud. Dan has served on panels and has given lectures at colleges, schools, given seminars on addiction. He specializes in adolescent treatment and family crisis intervention, utilizing various individual and group therapy modalities. Founder and executive director of the Florida Recovery Schools, Dan is a counselor in private practice. He has been a guest lecturer at Jacksonville University and University of North Florida, co-facilitator Duval County Public Schools Nighttime Substance Abuse Program, a member multidisciplinary team for Duval County, Adolescent Drug Court. Dan holds a BS in Social Science and Business Administration from Jacksonville University. He's an internationally certified drug alcohol counselor and certified addiction professional. Welcome, Dan.
Thank you very much, Jordan. Appreciate that. And Carrie, appreciate y'all for doing this. And thanks for having me. So we're gonna be talking about Florida Recovery Schools. So first of all, there I am with my goatee, which has now left, unfortunately, but I was told that I needed to change some things, so I did, and you know, whatever. So that's why the picture's different. It's not that long ago when it changed. So I'm a person in long-term recovery, and really, as a person who's been a part of the recovery community for most of my adult life, and someone who struggled as a teen with this issue, most of my professional life in a clinical world, and certainly in my volunteer work, has informed that. And so a lot of what we're going to talk about has to do with that, and how it is that the school came into be, and what the school is doing now, and what the hope for the school as we move forward. And so to begin with, I do not have any conflicts of interest. I don't believe. I'm going to disclose now that I do not work for anyone involved in this, and I'm not being paid to be here. This is all voluntary. It's a labor of love, and you know, this is really, I was asked to come here and talk about recovery schools, and that's what we're going to do. So thank you for attending, and I hope you learned something. And please, if you have any questions, ask. And I look forward to speaking with you. Okay, so really the idea behind a recovery school is at its most basic, I guess, essence, is that it's a school-based intervention, not unlike the drug-free workplace. You know, you go somewhere where people spend most of their time to help them, which saves money and time and excess trips. A lot of our families, especially, are, you know, they suffer from trip fatigue and you know, appointment fatigue. You know, they're tired of hearing about their kid did this and their kid did that, and they got to go to this meeting and they got to go to that meeting and they got to take time off from work. You know, and it's really a challenge for a lot of our families. So same as the workplace interventions through the drug-free workplace, the school-based intervention, same idea. So it's not a new idea, but this just looks at it strictly from a behavioral health challenge. So when we talk about substance use as a barrier to learning and looking at the protective factors and the risk factors, a lot of this will not be news. I don't know, I'm not sure who's in the audience, but for most of you, this will not be news. but it does bear repeating. Adolescents are curious, attention-seeking, thrill-seeking. For the most part, pain adverse, work adverse. They want to have fun, and they want to try new things, and they want to take risks. As part of together, and you add substance use to the mix, you get a myriad of problems. And so when we talk about these issues of alcohol and drug abuse, you get injuries and violence, including suicide, tobacco use, poor nutrition or impacts to their nutritional health, physical activity. A lot of kids that get involved with substance use stop participating in extracurricular activities such as sports, and then certainly sexual risky behaviors, whether that is age appropriate or not, and certainly can lead to a lot of unintended consequences, not least among those unintended pregnancies and sexually transmitted diseases. And so those are some of the challenges. And then the protective factors that we really can look at, that for a lot of youth, especially youth that are in the rural areas or in the inner city, the urban areas, some of these what we consider protective factors can sometimes end up being risk factors. And so it's not a given, especially when working with kids, as most of us know. But the community, family, and school certainly are critical. School being chief among those. Kids spend most of their time there. It's where their friends typically are, and their peer life is really of utmost importance, more important than family or community connections, almost always. And then, of course, individual friends or folks that may be influential peers. Could be a friend at a church. It could be a friend in some kind of program they're a part of. But certainly there can be that an individual that can be very important. It could be a positive or a negative influence in their life. And so so that's the other factor. So but we know that peers really drive the life of an adolescent, no question about it. So the recovery school looks at this idea of taking the idea of peer pressure and kind of turning it on its head. So if most kids, about 30% of kids that use substance, 30 to 35% of kids that use substance will get their substance suggesting that the school system is not doing everything they're supposed to protect their young people. It's just the fact that they're there. I mean, they're there all the time, and it's a target-rich environment for folks that distribute illicit substance, and it's a place where that's readily available. And so the kids will most of them will get their substance at school. And so we can take that environment, if we can create an environment that looks the same, but the peer structure in that environment is actually reverse in that it supports and promotes a different way of doing things, but in a language that's understandable by the youth, then that peer culture can be used to our advantage and help that young person make some different choices when it comes to behavioral health, especially in the areas of substance use. So we use the school as a way to really become a protective factor in a youth that may have otherwise struggled in that area. The other thing we know, and this is not as true in the earlier grades, but the more credentials someone develops, typically the less likelihood of them entering the criminal justice system and struggling with substance use. And we don't know which is chicken and which is egg. Obviously, it's very difficult to compete academically if you're impaired. So that may have a lot to do with it. Probably does. But either way, anecdotally, it does play out like that. And so the other thing we know is that kids that struggle with self-esteem issues, a lot of times will turn to substance use as a way to deal with that. And so as a result of that, success in school can help increase self-esteem and decrease the desire to use substance. And so the school also can be an environment that creates that possibility as well. Connectedness with school. So one of the things that we push above all else in the recovery school, we think of substance use as being a condition or a disease of isolation, characterized by isolation. And over time, substance use does isolate the user from, their support system. And, ultimately, the deeper you get into it, the more isolated you become. So the opposite of that, we think, is connection, right? So if we can create a community around that young person that is resilient and can also help maintain their recovery. And so the recovery school really pushes that idea of being connected with the school. We probably spend more time than anything on that idea. How do we keep the young person connected to the school? And we do a lot of talk about some of those as we go, but definitely that's very important, is that connectedness to the school. And then the last thing is that commitment to recovery. So there's a lot of benefits that come with going to or being a part of a group, right? That's why you join, whether it's football team or the track team or the math team or the chess team. There's benefits that accrue the participant, and they seek to enjoy those benefits, and so they try to maintain that connection with that organization. Recovery school is no different. We are a very low stress, low rule sort of environment. For a lot of the kids that come to us, it's the first time they've been in an environment where they did not feel like they were in danger or they had to somehow remain or somehow guard their safety. They don't have to worry about their stuff being stolen. They don't have to worry about somebody trying to hurt them. And it's very difficult to get kicked out of the school. So they're not necessarily going to, because of their behavior, get dismissed. So it really creates a sense of connection, but also a sense of security. And for a lot of them, that's, if not the only place, certainly one of the main places where they get that feeling. And so we really seek to maintain that environment. So a young person wants to be there. And because of that, they want that commitment to recovery. So what does the recovery school do? So recovery school, first of all, the word recovery, for those of us who are in the business side of this, the word recovery is a tricky word. And what makes it a tricky word is that the people in recovery can't even agree on what the definition of recovery is. And so when we start talking about recovery, especially around a school, people get all kinds of ideas. Is it grade recovery? Is it credit recovery? Is it, a child was somehow sick or whatever, and they're getting better, and then they're going to go back to their school? Almost never does someone equate the idea of recovery being around substance use. And a lot of that has to do with community-wise and society, where we still struggle with the concept of a youth having a substance use disorder. Believe it or not, there's still a lot of people that do not see that as an actual thing. A kid uses substance, it's a period thing, it's periodic, it's situational, they'll outgrow it, it's just a phase, etc. Lots of different things people will attribute it to. And for most kids, that is true. But for a small minority of the population, probably around 7% of the population, that's not true. In fact, their relationship with substance is one that needs to be addressed and probably arrested and done away with, or that youth is going to struggle in a lot of areas. Now, one of the things I would love for you to pay attention when we're going through this, if you don't listen to anything else that I'm talking about, listen to this, because this is one of the challenges that anybody that's a clinician working in this area, I don't know if any of y'all work in this area with adolescents as in the clinical spectrum, but one of the interesting things about substance use disorder, as defined by the DSM-5, and just an adolescent in general, they're very similar. In fact, it's very, if you read them, it's like, wow, that sounds like a typical teenager. So if you look at these things where it says, these are some of the symptoms of an adolescent substance misuse, but look at the list: loss of concentration, decrease in short-term memory. That's like every male high school kid ever. Loss of motivation. How many of y'all have a teenager or been around a teenager that didn't seem very motivated? Change in social behaviors, like every hour. Change in emotional and physical well-being. Feelings of paranoia. Oh, nobody likes me. Everybody likes me. You know, that girl doesn't like me. That girl doesn't mean it's nonstop. Change in appearance, you know, change in behavior, change of friends, drop in grades, signs of depression. I mean, this list could easily be attributed to most any high school or even middle school young person. So it's very difficult to say that just looking at this and say, okay, well, this is the problem. Well, maybe, but they could just be a typical teenager. So how do we begin to determine the difference? And so what we want to look at is certainly these things, right? A lot of them have to do more with, and often relate directly to specifics. You know, they've been playing sports for a long time and suddenly they decide not to play sports mid-season. They don't want to do it anymore. Their friend group radically changes. You know, it's one thing if, you know, if your best friend today is not your best friend tomorrow, you know, that's the price of being a teenager. But if there's like a whole scale change in your friend group, you know, signs of self-harm, signs of decreased personal hygiene. Now, again, every adolescent, especially, you know, girls struggle with use of deodorant, boys struggle with use of shower. I mean, there's a lot of challenges that go with that, but again, sudden, abrupt changes are certainly something to take a look at. So we look at these things and we really try to address these individually and corporately in the school system. And as a rule, just, you know, if we can help with these, it'll make for a better student, regardless of what the issue may be driving it. But if you take substance out of the mix, at least you don't have to worry about it. If substance is involved, then certainly it's easy enough to attribute some of that to this. So our program objectives, first and foremost, identify the barriers. All of our kids, whether they come from, you know, more affluent families or families where they're at or below the poverty line, which by the way, most of our youth are at or below the poverty line, have a mountain of challenges, whether it's academic, whether it's clinical, whether it's at home, in the community. Some of our kids, we've had kids that come to us that were homeless. We've had kids that come to us that were being abused or that had been abused. We've got kids that have been trafficked in our program. So there's lots and lots of challenges these kids face. And as a result of that, you know, it's very hard to worry about reading or concentrate on solving some sort of complex math problem if you haven't eaten in a while, or if you're not sure, you know, if you're going to have a home to go to when you get out of school. And so we really try to address psychosocial challenges with the youth from the start. You know, what's going on with you? So every child that comes to us gets a full clinical workup and a full academic workup. And out of that, we create a treatment plan or a care plan or an action plan, you know, whatever you want to call it, that is tailored to that youth. It covers everything from family and friends, history, use history, medical history, any type of identified or identifiable behavioral health issues, drug of choice, substance use history, you know, family background and family use history, medical issues, and then on the academic side, you know, behavior in school, attendance, you know, what grade level that most of our kids are, you know, 2 years out of grade level, a lot of them, you know, so why are you 2 years out of grade level? Is it because academically you can't compete, or is it because you've been getting high every day and you haven't, you know, really gone to school? And so, you know, identifying those barriers and then doing everything we can to eliminate them. And we have partners that help us with housing, help us with clothing, help us with food for our kids, you know, you name it. We have folks in town that we've developed relationships over the years that will help us with those aspects of that child's life and give them an opportunity, once those barriers are out of the way, to begin to focus on their academics. And a lot of times, once that happens, they thrive. They do very well. You know, when you love somebody and you take care of them, they tend to want to do better when they're in that environment because they feel safe and they feel secure and they feel like somebody cares about them. And that's really what we strive for in the schools. How do we develop that sense of of family and well-being and nurturing in that environment. And all my staff, which I have a freaking amazing staff, all of my staff really work to that end. And they know that is really, if we can do that, they can figure a child has the rest of their life learn how to add two numbers together. They only have a few years to learn how to be a good human and a good citizen. And we really want to work on helping them do that. Drug-specific information. We talk to the kids. Kids are all experts. Teenagers are experts on everything. But it's amazing how much they don't truly know. And so we really work with them on, substance use, STDs, things that are dangerous to them in the community from a harm reduction standpoint. How do we make your environment safer, and how do we make you safer in your environment? Signs and symptoms of substance use and addiction, not only in themselves, but in others, but really looking at, we monitor the kids really continually for suicide and also for substance use. Communication skills. A lot of our kids have a really difficult time, with boundaries, which is somewhat prevalent in all the substance involved community, but certainly with adolescents. And then the other thing is just communication, the ability to speak directly to another person. Most of them have been behind a screen, or they stay behind a screen. Having one-on-one direct communication is very difficult. Positive alternatives, which is really the idea behind the recovery school. And then our after-school program, which is an alternative peer group, is what it's called, an APG. And you can look that up. There's some really good information out there on alternative peer groups. They've been around since the 70s. Very, very good practice-based evidence approach to working with young people that struggle with substance use. Very effective. And this is the first one here, and it's going very well. Identifying and linking them to community resources. Responsibility for their own behavior. It's not somebody else's fault. Yes, you're in a crummy situation. Yes, your life is very difficult, but we can help, and you can do some things to help your situation. We're going to work on that. And then ultimately, we want our kids to graduate. One of the most, to me, one of the most terrible forms of discrimination is what I call the subtle discrimination of low expectations. A lot of our kids come to us and they don't expect much out of that young person. You know what? You came to school, great, congratulations. No, that don't work there where we are. We want you to come to school and perform. We want you to do your best, and we're going to push you and make sure you do it. And we want you to graduate, and we expect you to graduate, and we expect you to do well. And so we really work on that with our youth. How do we do that? We do it through individual counseling and group counseling, and a lot of other things that we add into the mix. They get counseling for their substance use, obviously, and their families get counseling as well. We use yoga, art, poetry, and music. We work on, through evidence-based programs, working on communication skills, alternative to substance use, and then, back to the community. And then the other thing, which is really, really important, especially for our young people, is relationship abuse. Working with them on safe dating, not only as the person that might be being unsafe, but also the person that may be the recipient of abusive behavior. A lot of our kids have poor role models, and they don't understand that someone hitting them or someone treating them badly is wrong. And so we work with them on safe dating practices. What constitutes abuse? What do you do if you feel like you're being abused? And we work with the Policy Center and others to that if we do have a youth that we feel like is either being trafficked or is being harmed in some way, to where we can get them access to some support right away and see if we can't alleviate that problem, and then to give them some proper support. And then lastly, we have a parent group that we talk with parents every week, not about their kid, but about them. Ask the parent, how you doing? What's going on with you this week? There's plenty of people that will call them about their kid. Almost never is a parent called and said, hey, how are you doing this week? And so we really make sure we try to connect with the parent or the caregiver. Most of our kids aren't with a parent, they're with someone else, but we certainly try to connect with that adult and say, how can we support you? What's going on with you this week? And I do that. This is our makeup, basically male, female. It's not uncommon. One thing I am very proud of is we typically have about as many females as we do males, which is very uncommon in a treatment setting. This is not truly a treatment setting. It's more of like an aftercare setting, I guess, if you want to put a point on it. But it certainly is a environment dealing with a behavioral health challenge. And so it's not often that you will find a, mix this close. So we're very excited about the fact that we're able to have almost as many females as males in our program. We certainly have LGBTQ youth, and we have had at least 2 youth that were in transition in our program, and we're able to support those youth, and we feel very good about that. And we have a great relationship with the LGBTQ community, and we maintain that, religiously and guardedly, because it's very important, we think. The racial mix, our racial mix is about 80% African American, about 20% other in our case. Mostly the other is obviously white or Caucasian. We do have a Hispanic, and occasionally we will have an Asian young person, but mostly African American and white is our primary makeup. And not by design, but we don't charge anything for our school. And so we opened our school up as a private nonprofit that is tuition free. And so we really did not want finances to be a barrier ever to any youth. They don't pay for lunch. They don't pay for anything. They don't pay for counseling. We do a field trip, we pay for it. We go on somewhere. If we go somewhere, we pay for it. If they need something, we provide for them. We don't charge them for that. And so really the idea is to make sure they have everything they need. And as a result of that, we're able to have kids that come to our program that are from all different parts of the community. And because we're in Springfield, in this particular case, downtown Jacksonville, we have a large population of African-American youth that, and most of them are urban. The other schools that we've opened, there's one in Orlando and there's one in Tampa. Their racial and ethnic mix is different. We're getting ready to open a school in West Palm Beach. Of course, it will probably have a different makeup as well. There's going to be one opening in Putnam County. And if all goes well, we're going to be opening one in Yalls County here not too long from now with Miss Pam B. I don't want to call her out too bad because she's probably listening. But if she's not listening, she should be. But, we're going to be opening a school down there, and we're looking forward to giving the same programming there. So look forward to that, and look forward to working with y'all when it comes to having a school there. But the mix is different because the access to recovery supports and the demographic makeup in every community is different. So schools tend to look like the area in which they find themselves. What are our numbers, and why the recovery score? And why do I say it fixes the gap in the continuum? So the continuum of care, as we all know, is, from, the school nurse, mom and dad, you get a boo-boo, mom and dad put a Band-Aid on it, all the way through to the most intensive therapies available in the community, regardless of what the situation, whether it's an orthopedic situation, a cosmetic situation, or an invasive surgery. So that whole realm, or that whole range of options, we think of as the continuum of care. And you all know that. So me telling you that is, probably somewhat redundant, but again, just making sure I don't know who's listening. So, but we look at this idea of oops, sorry, dang it. It shouldn't let me touch anything. Look at this idea of continuum of care. The Allison continuum in most places, especially when it comes to behavioral health, is woefully inadequate. What do I mean by that? Well, in a lot of places, you have, if you're lucky, you have outpatient counseling available to a young person, and you have inpatient treatment, and very little in between. Maybe there will be an IOP, usually not. And a lot of times there's not even an adolescent program in the community that's an inpatient program where they can go, and they have to go somewhere else to even get an inpatient program to attend. And so, so if you think about that, if you compare that to the health system, imagine if all we had in the health system was the primary care doctor in the ER. That's it. Or the hospital. You could even say the hospital, right? So you could either go to your primary care doctor or you could stay in the hospital. And we know that very few people need to stay in the hospital. And, you know, if you can go somewhere in between your primary care doctor and a specialist, maybe, then you don't have to go to the hospital, right? You can get whatever taken care of. And, you know, within an hour or two, you're fine. And then you're back at it. And so without those in-between steps, we spend a lot of money we don't have to. Youth end up not getting services they need because they can't afford or they can't get access to those extended stay options. And as a result of that, a lot of kids, as we know, go untreated. And so the recovery school can be filling that gap. So what happens if a kid goes to, let's say a kid gets into treatment, and then as a result of getting into treatment, they do the thing and they come back. So less than 10% will get treatment that need it, which most of us know that. 75% of all teens that come back relapse after leaving treatment. 47% of students returning to traditional high school resume full-blown use within a year, typically within a month. The first 60 days are the greatest risk of relapse. That's at any level, really, but certainly when a child goes to treatment, and one of the challenges about inpatient treatment for an adolescent is an adolescent in an inpatient environment can really be made to do pretty much most anything. In 30 days, you can get an adolescent, 30 days, 60 days, certainly, you can get an adolescent to do most anything. I mean, you can send a child to military school and they will become fairly proficient in military ways in 60 days. The problem is when they leave that environment, as we all know, the term extinction comes to mind, and that information that they learn, if not practiced, not unlike learning a new language or any other skill for that matter, will begin to erode. And as it erodes, the return to the mean or the previous behavior ensues. And all of that work that was done at treatment gets undone. You know, and that's a common thing. But unfortunately, in this instance, unlike them forgetting how to do Spanish a year after they could have been the best kid in the Spanish class it's ever been, a year later, they can barely, order off a menu. That doesn't create any kind of behavioral challenges, doesn't create any kind of legal problems, underemployment problems, societal problems. No one really cares or knows, for that matter, that person used to be really good at Spanish and now they're not. And it's not anything that's seen as a major crisis. But for a young person that returns to use, active use, and a lot of times their use will be even more intense once they return to use, the outcomes can be devastating, as we know. And so, and then often the treatment center itself is blamed for what happened. And really the problem is there's no follow-up care and there's no interim or in-between care to support that youth when they come back. When an adult goes to treatment, when that adult comes back, that adult has access to, an IOP program, an intensive outpatient program. They have access to an aftercare program. They have access to ongoing care with an individual counselor. There's lots and lots of options. And that's not to even mention the mutual support groups such as AA, NA, Celebrate Recovery, Smart Recovery, and the like that are available that are really driven or are geared towards adults. And so all of those supports are available to an adult. And even though they are there for the young person to take advantage of, getting a 14 or 15-year-old to attend a mutual support group for a lot of parents is a very challenging and very uncertain option, mainly because they're concerned for the safety of their child. As an adult, as a parent, you don't want to send your 14, 15-year-old, 16-year-old to a meeting where it's full of people that are known substance users. Even though they are in recovery, that may or may not mean anything to the family. especially when their youth just relapsed. So those kind of supports that are there for families or for adults are not there for young people. And so, so the young person coming back has very little in the way of support to help them continue to hone and practice those newly found skills. For a lot of youth, the better option would have been or would be to go to something like a recovery school or an in-between model that would allow them a chance to practice their new behaviors in real time. So can I go to the recovery school, learn about being drug and alcohol free, develop those new skills in real time, and practice them in the environment in which I live? Because the other challenge for an adolescent is if I send you back to the school you were in, that's kind of like sending a person coming back from treatment to the bar and saying, you know, you need to go to the bar every day and hang out at the bar and don't drink. And the chances of that person staying sober, as many of us know, go way, way down if that's the environment they continue to find themselves. So for an adolescent who does not have the ability to be mobile, doesn't have the option to change where they live or change where they go to school, putting them back in that environment with no support surrounding that environment, I mean, for them to relapse, for them not to relapse is amazing. And so as a result, most will. In fact, in the first year, almost all will return to use. Peer connections and interactions are critical, and most of which are going to be, designed for the young person to return to use. Schools provide the main system of peer interaction and support for adolescents and young adults. And again, like I said, you know, that environment is really set up for them to continue to use substance. And so we take that idea, and y'all are supposed to do this poll now. So do the poll, please. And then we take the recovery school as a way to use those same supports, that school-based support, and allow that young person to practice those skills in real time. And a lot of them can return to their home school once they've been with us for a while, as not unlike the way an adult would do if they went to an aftercare program or an intensive outpatient program. Well, I can't do anything on my screen until the poll goes away. I can't move my screen. There we go. Cool. So what does a recovery school look like? Well, it's a traditional public school for the most part, grades 7 to 12, which is a little different. We don't worry about what grade a kid is in. It's just whatever classes they're taking. So if they need classes for 7th grade, that's fine. We can program them for that. If they need classes for graduation, we can do that too. Same diploma as other high schools. Our school currently has about 20 pathways to graduation, everything from a certificate of completion to a honors certificate, graduating with honors in advanced classes. Just depends on where the child's at academically. We try to meet them where they are. The recovery school or the recovery program looks at a group and individual counseling, group activities, toxicology screening on a randomized basis, and all that is integrated with the academic program. So there's no, one of the things I always like to say is there are no those kids at our school. Everybody at our school, including me, was one of those kids. And if you're ever in one of those kids, that's a horrible position. It's a horrible place to be, is one of those kids. Once you become one of those kids, you're marked. And everything you do is seen with a somewhat jaundiced eye. And so we say we're all one of those kids. Everybody at our school is one of those kids. And so if a kid has to go see the counselor or wants to go see the counselor, if a kid needs extra help, if a kid's struggling with something, there's no stigma. There's no, oh my gosh, you got to go see so-and-so. For one, there's no office. If a kid gets in trouble at our school, there's no office. We don't have a punitive, we're not a punitive model. We'll talk about that in a minute, but we're not a punitive model. So a child cannot get, punished at our school. And so if they come to our school and they do something that's outside of the expectation of them, then we address that in the form of support, not in the form of punishment. So they get everything's integrated with the academic program. Ages 14 to 19 in the school, and the after school program or the alternative peer group, that's ages 14 and up. Anybody can be a part of that, whether they're a part of the school or not. They're welcome to attend the alternative peer group. And we do everything in there from GED, prep, English language learning, English as a second language. We do yoga, art, music, all kinds of things in that program in the afternoon. Kids in our program can also do a GED during the school day if they are so inclined. If they're over 16 and they're going to run out of calendar before they run out of classes, we have the ability to offer them the GED, and the school system will honor that. Desire to stay abstinent and want to finish school. Notice it did not say they had to be abstinent, just a desire to stay abstinent. They want to get better and do better. And so we want to help them with that. If you fail a drug test, you will not get kicked out of the school. I've always thought that was kind of dumb. Person comes to me and said they have a problem with substance use and they return to use during our work together, and now I'm going to kick them out. That doesn't make any sense to me. They said they had a problem when they came to see me. So we don't do that. We don't kick a kid out. We get kids from all over. Duval County Schools, or the school system, is a primary provider of youth, but we also get them from the Department of Juvenile Justice. We have great relationships with our partners at Department of Juvenile Justice. And I serve on the state board of the Florida Department of Juvenile Justice, and also work very closely with our DJJ personnel locally. I have a great relationship with them. Our treatment centers and other individual providers. We are fortunate in Jacksonville to have Gateway Community Services, which is an amazing program. Does have an adolescent program as a part of it. The challenge with a lot of adolescent substance providers, though, is most of the kids that go to those programs are from somewhere else. We tend to send our kids to them, and they send their kids to us, mainly because you don't want your kid to be in a program where their buddies can come, talk them over the wall. And so you tend to send kids somewhere else. A lot of kids that are in those programs are from somewhere else. So you don't get as many kids from the treatment center as you would think. Family members and self-referral. We've been around about 7 years now. We were the first recovery school in the Southeast. The one here in Jacksonville was. And we've been around about 7 years, and we get almost every day somebody will call and say, hey, so-and-so told me about your school. I want to send my loved one there. And so we get a lot of referrals that way. And we're very blessed to have that. Screening. The clinical part is critical to what we do for a lot of reasons, mainly for safety to begin with. We got kids that are coming to us that are sometimes in active use. In fact, often they are. They haven't had the benefit of treatment. We want to make sure that what they're taking is something that we can manage. If not, then we need to send them to a higher level of care until they are stable enough to come with us. And so we want to make sure they're going to be safe, and we're going to be safe. For those of the clinicians in the room, we work on a ASAM criteria of level 2 or below. That's an intensive outpatient level of care or below. We can't take a child, nor is it safe for us to take a child over that. We also check kids for depression, suicide, anxiety. We do an ACE score on all of our kids. And we've just started academic testing through the NWEA mapping process, which is a national screening tool that looks at kids across the whole system and how they're doing academically. To get into the school, we have a team interview. Almost no kid is turned down to come in. We certainly want to screen them as a team to make sure that we pick up on anything that may be a special interest or care that we need to take care of. And then we're more or less an aftercare model, as I discussed a minute ago. This is just some numbers and how we've done over the time we've been doing this. We get started in 2016. We've had over 200 kids come to the program. That slide needs to be fixed. I thought I fixed it. Over 200 kids have come to the program. Average stay with us is about 150 days, or about a school year. It costs about $6,000 a day, per episode for a kid to come to us. So basically we can do a school year for a kid for about $7,000, which is unbelievably reasonably priced. Doesn't cost the family anything, but it does cost us about $7,000 per youth. About 68% of our kids end up doing very well after they leave us and they stay in school. About 64% of our kids will maintain a greater number of drug-free days, and our academic activity is around 70%. Most of our kids, when they come to us, have 0 drug-free days and 0 academic participation. And we've got the numbers up to 64% on the drugs, drug-free days, and 70% on the academics. We've had, that slide says 15, but we've actually had about 20 graduates now. That's a weird number because most of the kids that come to us, or a lot of the kids that come to us, aren't really in a position to graduate. They're not there yet. And some will get like, they may decide to drop out of school or whatever, which is unfortunate. But of the kids that were eligible to graduate, those kids have graduated. Our code of conduct is based on restorative justice. We use the 12-step principles, not the 12 steps themselves, but the principles behind the steps. Harm reduction, and it's integrated, like I said, academic model. And then the alternative peer group, which is the after-school program. And these slides will be available if anybody wants them. But essentially, an alternative peer group is exactly what it says. If a young person decides they want to leave their friend group where they're actively using substance and join another group at school, a lot of times those groups won't allow them or won't let them in because of their history. And so they end up not being able to be in any group. And so the alternative peer group is exactly that. It's peers that are like them, that think like them and talk like them, but they're not using substance anymore, and they're able to basically, in essence, join a new friend group. And it's very successful. Like I said, there's some good information out there about alternative peer groups. So look that up. And then our newest endeavor is really, we're going hard after the Hispanic community. Our Hispanic community in Jacksonville, the females are being targeted for trafficking and heroin use. And in fact, there's some evidence to support the fact that our adolescent female population in Jacksonville or in Duval County is the highest utilizer in that category of heroin in the country. And we believe they're doing it as a way to entice them or trap them into trafficking activities. And so we have put together a team, and we're working with the trafficking task force. We're working with the sheriff's office, the mayor's office, and the Department of Juvenile Justice to aggressively work with and go after those young people, trying to get them into school, get them drug-free, and help them get out of that situation. And I'd be happy to share more about that if anybody's interested. But it is something that's very near and dear to me. I take it quite personally if somebody's poisoning our kids and using them for their own amusement. This just talks about what we're doing to help develop that program. And a typical day with us, we have a check-in. We have 2 academic blocks. We have lunch. Then we have a gender-specific group, and then we have the alternative peer group that starts at 3 o'clock in the afternoon and goes from 3 to 6. And that's every day except for Friday. Kids get out early on Fridays, they work hard all week, and so we give them a break on Fridays, and that's it. So that's the whole show, and I would love to take questions. Everybody's got any? How about that? 10 minutes to spare.
Thank you so much, Dan. So if anybody does have any questions, you can raise your hand at this time using the reactions button at the bottom of your screen. We'll then call on you and allow yourself to unmute. We will be alternating between questions entered in the chat and by raised hands. Does anybody have any questions? I do want to point out that Carrie had said, love Miss Pam B. And Michelle had said, excited to hear about a recovery school in our country.
Wonderful. Yeah, Pam's great. Pam actually serves on our academic committee for the state for recovery schools, and she's helping us with the institution of our academic program for the state, for our schools that we're opening statewide. And all of our funding, by the way, comes from either the state, the city, or individual contributions. So we do not get any funding from the school system at all.
We do have a question from Michelle. Do you have any limit on enrollment?
No, we do. We will not, in our building that we're in right now, we would not take more than about 50 kids at a time inside the building. This is because of the standpoint, we really want to get to know the kids. These schools by definition are small. We would open another campus if we got another wing of the room if we had more than 50 kids. But yeah, so 50 at that location where we are, be about the top number. We would open another location at that point.
I have a question. Is there any Can they come from anywhere? Do they have to be from that particular county type deal?
No, one of the great things about Florida is a few years ago, Florida did away with school districts. So there are no school boundaries anymore. So if you want to go to school in Miami-Dade County, if you can get there, you can go there. And so same with us. So we get kids from St. John's, we get kids from Clay, we get kids from Nassau that come to our school, which is why we're trying to open schools in other areas. We'll get families that'll call us and say, we're going to move to your area so our kid can come to your school. Because these schools are not available everywhere. There's only about 45 of them in the country. And so as they grow and as we have more schools, that will become less and less of an issue. But our hope is to have a school in every county in the state of Florida. That's where I probably won't live long to see that, but I certainly hope that we can do that at some point, where we have this option available to every youth in the community. We have about 127,000 adolescents in the state of Florida that qualify for a diagnosis of substance use disorder. That's a lot of young people. And we have about 5 treatment centers to deal with them. So obviously we're not even close to the number of beds we need for that number of kids. So these schools can be very, very important.
No, for sure. I can definitely say that they would have been important for myself growing up. So
10-4, me too. Yeah.
are there any other questions from anyone? Alrighty. Well, thank you so much, Dan, for sharing your expertise today. Attendees, please make sure you use the link in the chat to complete the evaluation survey for the session. And thanks to the Florida State University for managing summit evaluations. If you requested any CEUs, you have to complete the survey to receive the CEUs. And thank you everyone for attending the session. We do hope you'll be attending the summit tomorrow. Please make sure you go to your summit program PDF or visit the pathforhope.com Summit 2021 website and click the link for tomorrow's morning's brief welcome session. And I hope everybody has a great rest of their afternoon.
Yeah, thank you all. Thanks for being here.